Good afternoon, ladies and gentlemen. I was born in Cameroon, and I've grown touched by the beauties and the challenges common to developing countries. As a child, I came close to losing my sister sitting back there to misdiagnosis. She was being treated for typhoid while she was suffering from malaria. If not for an educated nurse in the neighborhood, we might have lost her. This story is common to many in developing countries. Remember, this challenge is not only for locals. There are thousands of tourists coming in developing countries yearly. Years later, looking at the ecosystem of healthcare in developing countries, I realized that there are 2 medical professionals available and serving the need of 10,000 healthcare seekers. This is without counting the 100 million tourists visiting those places yearly. There is not enough information flowing among those people, and poor infrastructure does not help the matter in order to support and balance the act between demand and supply. One of the beauties of many developing countries is its power of community values. And what that community value stands for is we share. We share finances, we share support rationally and emotionally. And often that support is visible through, if I'm ill and I reach out to my sister, she's going to pay my bills. What is tough, though, is that the lack of education, of infrastructure, but also of security makes many people either misusing this fund or it's often stolen. Despite all I've talked about now, what is amazing was the penetration of mobile technology in developing countries, and I'm sure you've heard about it. This has been an outplay for the poor infrastructure that is existing over there, and something MEDx eHealthCenter is also looking to tap into to deliver on 3 critical topics: information, medical records, but also provide a space for relatives to care for each other one way or the other. We've had a chat with the team, with a powerful lady working at Accenture, not making any advertisement, where she was saying, why are you different? We've tried it in developed countries, digitalizing healthcare. Why would you be different? There are 2 ways we see we will be different. One, flexibility. We're a startup, we can experiment. Second, simplicity in many developing countries. Simplicity reflected on the protocols and simplicity reflected on the processes. Well, having said all of this, how are we going to make it happen? We've actually started the journey already, where we're taking 2 routes for implementation. First, applying that simplicity, focusing on making the information flow. Information flow through medical professionals, making themselves visible out there, who they are, where they are, and what is their specialties. But we also want to make visible patients. Who are they and where are they located? That will be our first stream of information flow. The second focus of the implementation will be about creating relationships. This will happen later. That relationship will focus on linking patients to medical professional to patients, and relatives to patient, very important topic. Well, my name is Patricia Monthé. I've had years of experience at corporate level, and I strongly believe that visibility and access to educated medical professionals is critical for family well-being across the globe, even more so in countries where healthcare access is very difficult. Join me in this quest, and let's reach out to big institutions. Let's reach out to mobile technology savvies, because we need these in order to make this project a success. Thank you very much. Thank you for listening.